Are you interested in becoming a clinic nurse? Well, I have the tips for you in this video. I used to work as a primary care clinic nurse, and I did that for about, I want to say like 2 years. So I have all the tea for you so that you can land a clinic nursing job as well. So let's get right into the video because I know you want to know all about it. Now, if you have not seen the video where I talk about what I did as a primary care nurse, I'm going to link it down in the description box so that you can check it out after this video. But let's get right into the video. So first of all, you do need an RN license. You do not need any special certification, although if you do have ambulatory care nursing certification, I think that would be pretty valuable. I was working on getting that certification, but then I left that role and I never ended up getting it. But you would need at least 2 years of ambulatory care experience prior to you being even able to apply to that certification, like to do the certification. So anyways, a bedside nursing experience is usually preferred but not required. I say this in all my videos. Just because a nursing position says it is preferred, it does not mean it's required, so apply anyway. So I actually did know a nurse who started in clinic nursing and only had 6 months of bedside nursing experience under her belt. So I mean, it is possible. There's always exceptions to everything. So before I started clinic nursing, I used to work as a med-surg tele nurse. Now, let me tell you the skills that I think would be beneficial for you to make sure that you add to your nursing resume. So triaging is huge because pretty much all the RNs in the clinic were the ones doing the triaging for the providers. So the LVNs would do a whole different role and the RNs would be doing the triaging. So if you have triaging skills, make sure you add that on your resume because that's what we were doing. We were triaging every walk-in patient who came in to see the provider that we were assigned to. Also, if you're familiar with like chronic disease management, like diabetes and all that, that would be super helpful. We were also doing a lot of teaching on like diabetes and how to give yourself like the insulin injections. So we were teaching patients how to do that. So just being knowledgeable in chronic disease management will be super helpful for you. And also obviously have confidence in your nursing skills. Because like I said, in my specific role, what I was doing is not only was I triaging, we were doing like nursing procedures. I was removing staples, sutures, I was putting in urinary catheters, we were doing bladder scans. We never had to do IVs, we didn't have to do IV fluids, nothing like that, no EKGs. But I mean, in some clinics, they do want you to do that. So being confident in your nursing skills would be like super helpful for you in these specific clinic nursing roles. And the other reason why I say that it's important to be confident in your nursing skills is because in the clinic, as the registered nurse, we had a lot of autonomy. So if a patient came in, told us their symptoms, and we thought like, okay, this is not really something that the doctor has to see you for right this moment. Like if it's been going on for 6 months, like he doesn't need to see you right now, you know? I mean, unless it's something like super obvious, like shortness of breath or chest pain, you know? But I mean, that usually wouldn't happen for like such a long period of time. So in that clinic nursing role, we had a lot of autonomy and we would decide whether the patient would be seen or not that same day, or if we would just make them an appointment. So being confident in those skills, being confident in your triaging skills and knowing what to ask is super beneficial. So if you have any other questions, please leave them down in the comments. If I missed anything, ask me and I will address it in the comments. Make sure to like this video, subscribe, ring the bell for notifications, and I will see you guys on my next video.